The Connection podcast, hosted by Yuma County Anti-Drug Coalition and Yuma County Mental Health Coalition, is a community-focused podcast dedicated to informing, educating, and empowering listeners on drug prevention, mental health awareness, and strengthening partnerships for a healthier future.
Hi there, and welcome to the Connection podcast with Yuma County Anti-Drug Coalition and Yuma County Mental Health Coalition. I am Joanne Pfizer, the Executive Director of the Yuma County Anti-Drug Coalition, and I am super excited to share with you our guest today, Ryan Butcher. Welcome.
Thanks for having me. Appreciate it.
Well, let everyone know who you're with, all that good stuff. I do have to brag. Ryan Butcher is our vice chair of our Yuma County Anti-Drug Coalition, and he's been a champion for a lot of years, and we just really appreciate all the education and support that he brings to our board, and we just are excited to have you here as a guest. So
yeah, thank
share.
you. Yeah, so Ryan Butcher, and I'm with the Yuma County Health District. I've been with the Health District now for, I think it was 18 years in February. So, and then Public Relations and Community Engagement Coordinator. And like you said, been the co-chair for the Anti-Drug Coalition the past 3-4 years now.
Yeah.
It's going by fast.
It does go by quick, but we thank you for being here today. We have a lot to dive into, and I'm just going to go ahead and get started.
Let's do it.
So, how has public health traditionally been involved in addressing substance misuse and mental health? And how has that role evolved over the years? Because we know it looks so much different even since COVID.
Sure. I guess the one thing, I'll start off with the one thing that's been constant, and that's that we're always adapting and we're always changing. So, I mean, that's something that is public health. We always kind of have to adapt and evolve with our community and the needs of our community. I think traditionally addressing substance use and mental health, we do a lot of things like community health assessments and our community health improvement plans, which
That's awesome.
you've had the opportunity to be a part of as of late. But sometimes when those key health priorities such as substance use and mental health come up, we're really playing a really supportive role traditionally in the past, because a lot of the work we do, although there might be some things that we touch on with those, we didn't really play a driving part in that. We've also been in the schools a lot, and some of the programs that we've had maybe don't address substance use and mental health specifically, but they do in a roundabout way. So you take something like bullying prevention that we've done in the past, where it's trauma informed, and you are educating these students on giving them resiliency skills, refusal skills, and how to deal with tough situations, and how to adapt and take all that in. So there's components of that, and that we've always kind of done and touched on. But I think really in the past, post COVID, things have really shifted a little bit. As I mentioned, as our health priorities and some of the things change, we have to change with it. And one thing that we saw, with our youth specifically in terms of some of the fatalities, is they really kind of shifted from, I'll take the teenage population, something that's been motor vehicle crashes as being the leading cause of death for teens.
Wow.
For a long, long time.
Right.
And that changed. And now, in recent years, it's been suicide and substance use, and specifically overdoses, resulting in fatalities. So, as that changes, you have to kind of adapt and change with it. And the same thing in our adult populations. We saw a lot of our non-fatal overdoses as well as our fatal overdoses increase. Mental health has always kind of been there, and been a huge issue and a huge emphasis. But I think post-COVID, we've really seen there's been a lot of light shed on it, and
Yes.
it's been a lot more at the forefront. So with that, comes funding. So we've been able to apply for some different funding. We have several fatality reviews, which we'll probably talk about a little bit more later. But those provide us to really take a deep dive into some of those topics. And there's also some additional funding for like our overdose data action grant, our naloxone distribution program. So it really puts us more at the forefront and working with a lot of the partners that we did before, but just having a little bit bigger role and being able to support them a little bit better than we have in years past.
That's awesome, and it's all so important. And I think that when you think about everything that you just mentioned, everything impacts our community, but it also impacts the nation. and knowing that you guys do what you do for our community is huge. you
Yeah,
know?
and I know, it seems like this is said at every meeting that we have, but it's such a huge topic, and there's not one entity that can tackle this alone, right?
Right.
And I think that's what makes, our entities here and Yuma specifically so great. A lot of us were born or raised here, and
Right.
we're from here, we live here, and, we want to see things get better here, and we want to help out our community members, and that's what the health district's all about.
I think that's awesome because we do want a healthier and safer community, but by all of us coming together and sharing our resources. Monthly we meet, our coalition meeting is, but also sharing our resources online and doing these things and getting the information out to our community. I want to touch back on the naloxone distribution
Sure.
program. I think that that's important in so many different ways. Can you share a little bit more about that?
Sure. So our naloxone distribution program, I think the main goal there is getting naloxone into those who need it, right? That would mean people who use drugs, and their families and their friends. So it's really our key to get it out there and into the hands of people who need it most. So specifically what our program does is we work with different entities. So really for the purpose of either first aid response or for distribution to the community.
That's awesome.
So we'll talk about first aid response first. So, some of our biggest partners have been our school districts. We have kids that, unfortunately are at risk and decide to, make those tough choices sometimes and use substances. So unfortunately, we do need it in our schools, and so that we do have naloxone in the schools, and working with Bo, who was on here recently, has been a big driver in that and helping us make sure that we have naloxone that's accessible on campuses in the unfortunate event that they need to use it. And then, we have private businesses, we have different harm reduction agencies on board, healthcare agencies. Anybody who's interested in the program basically can contact us, and we can work with them on providing them with naloxone. Some of the other agencies that play a huge part are also our harm reduction agencies and some
Right.
of our healthcare providers that act as distribution centers. The good thing about naloxone now is it is over the counter, and you can just go and purchase it in a store. But there's still, stigma around naloxone, and maybe being embarrassed to buy it or need it. Cost will always be a barrier.
Right.
And these distribution centers are fantastic. So not only do they work with people who use drugs and their families and their friends and people who can actually respond to someone who is overdosing and potentially save a life, but they work with these communities, and people are getting to know a little bit more of them. And that stigma is decreasing a little bit, and they're having these conversations with these
positive.
agencies. So people can walk in, ask for a box of naloxone, and these agencies will provide them with a free box. No questions asked, no cost. It's just really about getting that naloxone out to those that need it and those that want to make a difference and, potentially save a life.
That's true. And you don't think that your family will be affected, but there's no harm in having it in your home or with you, because you can be maybe even at a party that you didn't know something like that was going to happen, and you could be the one to save a life.
There's always certain twists with different substances, and fentanyl, I think specifically, if you haven't seen it in our coalition meetings and some of the, just the community members that are there, or some of the business owners that are there, or any one of the members that
Right.
that do the work that we do. I think one thing that comes out of this is, unlike any drug, this really does affect anybody and everybody. A lot of times in the past, you might have, certain stigmas around certain drugs are tied to certain socioeconomic status or certain populations. And I think this one has really opened eyes because it's, so easy to get, it's so cheap, it's odorless, it's tasteless, it's so easy to conceal. And unfortunately, that's what is making it more attractive to some of these individuals that use it. It's across the board,
Right.
in terms of the fatality reviews, and some of these things that we're seeing in terms of data, without going into specifics, we see it all across the board, every race, ethnicity, age group,
Yeah.
anything, all across the board is all I can say. So, and that's something that makes it really hard in terms of response is, we're really trying to get it out to anybody and everybody, and sometimes getting past that stigma or that whatever it is, and really getting past to this is something we need to get out there a little bit more. But yeah, so I think that's part of it, and I think people are starting to come on board. Where in years past it was a little bit more stigmatized or a little bit harder to get access to naloxone. We're seeing it easier and easier. We're having those conversations, and that all, that's all part of getting the community involved, getting the right individuals involved. And, like I said, you see that with certain people that are in the coalition that have been impacted by it, and been able to shed a little bit of light on it.
Well, and I think what's important is that it is growing. We are sharing it with more people. We're breaking that stigma. And one of the great things that I was able to help with is the partnership with Onvida. And, exiting that emergency room when you've come in for a family member or somebody close that, has had to deal with, fentanyl, opioids of some type. They're going away with an emergency kit to take home. Tell them a little bit about that and how all that came together, because you really had a big role in it.
Sure. So, I mentioned our role, and I think we'll get into it a little bit later about fatality reviews, but, we basically will look at some of these things and come up with recommendations. So there was a recommendation, some of the things that we saw, that there was an opportunity to have a discussion with the hospital about naloxone. Several hospitals across the state do provide naloxone kits at discharge to someone who was brought in due to an overdose or who is a known drug user. And there's some fantastic people over there at Onvida. Yeah. So luckily I work with a number of them on several different projects and different things. So I reached out to the right people, and we started just to have those conversations. And it was a long time coming. There's so many things that the hospital has to take into consideration, and they're extremely busy over there, but they made the time, they continued the conversation, and I was able to kind of link them up with the state health department and help them kind of navigate that. And, kudos to them for really taking the initiative to get it into the hospital. And part of that was wanting to provide some education and some resources locally, and not just an naloxone kit. So that's where the light bulb went off, and I said, I know just the people. So that's when I contacted the coalition and said, hey, we have a great opportunity here to get with our members and our people that are already in the coalition, our providers and agencies here locally, put together some information, something short and sweet that's not going to overwhelm somebody or the family members that are in that circumstance, but that can use when the time is right. And we paired that with an naloxone kit, and you guys did a great job of doing that, not only doing it, but doing it quickly. And it was something that's been implemented, and it's been working great. And
it helps our community.
Absolutely.
I mean, it's awesome. They go home with a kit. Yuma County Anti-Drug Coalition has all the resources in there. They have the naloxone, and all of the local agencies, if they need more help, when they're home, they can call them directly. It's just amazing. Yeah. And that just shows our work in action. It's so exciting. But I do want to ask you about the fatality review earlier. I'm wondering if you can explain the role these play in public health and substance misuse and mental health, because I think that's huge.
Sure.
I want you to go ahead and share that.
So there's several different types of fatality reviews, but the overarching goal is you're really diving down into the circumstances of an individual's death, and kind of picking apart the different factors that maybe play into it. And then the overarching goal is to come away with some type of recommendations. We're trying to identify some opportunities for intervention, and whether that be maybe, and some recommendations to come out of that. So what I mean by opportunities for intervention, I'll just use the case in point that we just talked about with the hospital. Some of the things that we saw, and you see this across the state, where maybe individuals are coming into the ED several times before, a fatal overdose. Right. So, and for every fatal overdose we have, there's going to be typically there are a lot of, overdoses sometimes that lead up to that. So anytime you can catch somebody that's a non-fatal overdose, it's a great opportunity, because, that's when they're, not everybody's the same, but that's when they're most receptive to making a change and open to maybe getting treatment and getting help. So you want to take advantage of that opportunity. So, we saw some things where we had some non-fatals in the hospital setting, and we knew that there wasn't any naloxone being distributed. So that's where those conversations start. What are the barriers you guys are having, and what can we do to help? And you just start having, it's literally started with somebody on our team who worked for that agency, and you just start having those conversations, and can we do this? And what barriers are there, and you just keep it going. And it was a kind of a long time coming, but eventually it gets done, and we were fortunate to do that. So that's what these fatality reviews do. You really kind of get to dive deep into these circumstances, and no two cases are alike and exactly the same, which is, you may come up with 5-6 recommendations for one case that we review, and you may come up with 1 or 0 for another. So it really just depends, but you get to kind of dive deep into these and really look and pinpoint some of the root causes of why somebody is getting to this point. That might be lack of treatment providers, that might be stigma in the family or the culture, that might be insurance.
Or a mental health issue. It could be a root cause from the beginning.
Yeah, so there's lots of things there. So, and that's, a lot of our agencies address a lot of that stuff. So in public health, we have a term called social determinants of health. And that's where we eat, live, pray, and play, right? It's the things that affect our health on a daily basis. So if we live somewhere where, the grocery store is 10 miles away and I don't have a vehicle and we don't have public transportation, I have to walk 10 miles to the grocery store.
Right.
I'm probably walking to the gas station for my dinner or to get groceries. So that affects your health. So it's no different in terms of services for substance use or mental health. So we have a lot of agencies that address those. So again, that's kind of what these fatality reviews are. We have first responders, we have medical providers, we have our harm reduction, we have advocacy groups, we have physicians. We really try to build out those teams to every different type of agency that could play a part in those, to really try to round it out and get different perspectives. And you dive deep and you look at some of those things and you come out with some great, sometimes they're local recommendations, sometimes they're state recommendations. It might be something as easy as we need to increase just general education and outreach in the community, specifically to parents, like we saw with fentanyl.
Right.
Or it might be something much larger on working with kind of advocating to your education institutions about growing your own and getting some of these things that we're starting to see here, right? We're starting to see some of that get done. So some of these things take years to implement and maybe can't be done locally and have to be done at the state level. But we've already seen some of the local ones that we've been able to tackle ourselves through the naloxone and some of those things. So it really kind of depends, but that's kind of where those fatality reviews come into play. We get to dive deep, really look at the root causes and really find out what happened, which sometimes, the public perspective sees one thing and they don't always see the whole picture, and that's really what it is. We really get to try to see as big a picture as we can, gather as much detail and information as we can so we can make those educated and those recommendations.
Well, and it does take a big group. It does take those meetings. It does take the talking, but it has to be orchestrated by someone or an agency. And you guys have done a really good job in doing that. And, just like you said, the, planning that we're doing right now and that the coalition is part of, that is huge for everyone in our community, depending on, if it is housing or if it is, childcare or, what is it that we're missing?
Yeah, and then those subject matter experts. I mean, I can't say enough about the partners and the agencies that participate in those.
Yes, they're huge.
The only reason I know as much about mental health and substance use now than I did 3-4 years ago is because of the agencies that we work with. I pick their brain. I ask them a million questions that they're probably tired of me asking them, but that's how we learn. We have to have those conversations, and we don't know what we don't know. So we, that's why we have those partners. That's why we bring them in, because they're the ones that are doing those types of. They're working with those populations day in and day out.
Well, and I see all of these agencies helping other agencies. Like you said, you call on them, you ask on them, you talk to, the leaders in their organizations. They become, close friends, and you just give them a call. They help you, no matter what. They pick up the phone. It's just amazing. And they're so knowledgeable in their own field, but they're willing to help in other fields. How have you seen that play a key role in coalition? Because you have been part of this coalition for a long time, and you've seen the growth, and you've seen, that interaction and how we've gotten the message out and getting into the schools and being, having it be easier to be able to get into the schools and share with parents and different things like that. How have you seen that transition?
It's always about the people, right? You have agencies and whether it be state, local, federal, but it's always about the people. And, that's what makes us, Yuma so great. All communities and cities and towns are going to have their issues, and nobody's going to ever be perfect. But one thing about the coalition in itself, again, is the people that are there care. You don't get into mental health or substance use or some of these agencies for the money a lot of the times, right? It's because you want to make a difference. Sometimes we all have our our own lived experience, or we've gone through things with mental health in our families, our friends, or substance use. So, these are things that affect people and families. It's not just the individual that is having a substance use issue. It's that family.
Right.
It spreads out, and it has a lifelong impact on the individuals around that person who's struggling. So, whether it be with substance use or mental health. So, that casts a wide net, and
right.
That's why a lot of these people end up and do what they do, is because they care and they've been impacted from it. So when you take something like that, it's not just the job, it's more of a life passion or something that's near and dear to you. It's not work, right? When you love what you do, it's not work. You get to go do it every day and try to make an impact and try to change the things you care about. And I think that's why the people in that coalition are so great. That's why they're so willing to share and to help individuals. And it helps when you see the work being done, right? Right. When you come up together, and I think we've all been to a part of meetings that we meet, and sometimes things don't get done. Yeah. Right. So, it helps when the work that you're doing or the meetings that you're having have impact, and there's actionable items that come of it. I don't think that I've been to a meeting yet where we didn't have something to report on of something that we're doing, whether it be our agency, the coalition specifically, or collaborating agencies. There's always some type of collaboration. Something's happening. Something's in the works. And I think that's important, right? We have to move the needle, and we don't always have to try to, take the biggest statue on in the room. Sometimes it's something small and an act of kindness or something to get the ball rolling. And sometimes we don't know how big an impact the small things do, right? So, and I think we've seen that as well. So I think it's just about, the people that are there, that they care and they want to make a difference. And a lot of us are from here, born here, raised here, lived here for a while, if not. So, that's something that we want to, pass on to our kids, and a lot of us have kids, and, they're that age, and so I think it's just all those components and coming together, and it's a great coalition, and we're glad to be a part of it.
Well, I'm excited to be a part of it. I'm excited that everyone that does participate is compassionate about our community and what they do. And I think you nailed it. Everyone who's there wants to be there, and they're there for individuals and to help each other. And it's just amazing. I mean, the energy, just from all of us there being together, knowing that we're making this big of a difference is huge. And we're from all over. I have a list here, our sectors in the community that come together, they range from business, media, law enforcement, healthcare agencies, civic groups, governmental agencies, faith-based groups. I could go on and on and on. And individuals, like you said, if you've been impacted, in any of, our mission, your substance misuse, your mental health awareness, there is somebody that is there that's compassionate about what we're doing, what they want to do, and make a difference and learn more. And they always go away with something.
Yeah, and I think that goes back to one of your questions you asked earlier about the impact of some of these drugs, or you know, what makes the coalition so great. And again, it's because so many people are impacted, and it doesn't, you know, it doesn't, you know, it can happen to anybody and everybody. And I think that's indicative of what you see at the coalition. You know, you see people from all these different sectors that have been impacted, and that's why they're there. You know, some of these sectors, maybe the sector doesn't have a role specifically in addressing that, other than to get the word out about the coalition and the work that we're doing.
Exactly.
Right? But the reason that they're there is because they were impacted one way or the other. And that's what makes it so impactful, right? Is when you have people that care about what they're doing, it's not work. It's part of a mission and what you want to do, and keep your community safe. And
you can tell people enjoy it. They enjoy their positions. They enjoy where they are. They enjoy being with us, and they learn every time they come. They are learning. You know, who's ever up there presenting, you're going to go away with something.
That's a great point, you know, and I think sometimes we know of the agencies in town, right? But we don't always know what they do, or we don't know the specifics. And I think every time somebody gets up and presents on something, and you have that opportunity to kind of dig down and ask those questions, you learn a little bit more.
Oh, totally.
And I've seen some of these agencies present before, and each time I see them, I'm like, I'll take something new away, or I'll have another question that I didn't have before, because now I know more than I did last time, and now I have a different outlook on it, or I'm thinking differently of how I want to ask a question, or maybe something's came up in work that we do now that, you know, I didn't have that perspective before. So, learning of what all these agencies do and the minute details, it's invaluable, right? I mean, we can't stop learning. We have to continuously learn and adapt, and that's what these coalition meetings do, is they provide that platform for us, not only for networking and things like that, but, you know, to learn from these agencies. And hopefully that's what this podcast will do too, right?
That's exactly what I was going to say.
It'll provide a platform to learn a little bit more about our agencies and what role they play in addressing this, you know, two-headed monster.
I think that's a perfect way to wrap this up. I am excited that you were able to be here and share. Thank you so much for your time. We're excited that everyone that has been able to listen and watch, because we are on all social media handles, to be able to hear our message today and really go away with something from our Connection podcast. You know, it's something that the Yuma County Anti-Drug Coalition and Yuma County Mental Health Coalition are passionate about, and giving the information and resources to our community. So definitely find us at our website, ycadc.org or ycmhc.org, and you can just pop us an email if a coalition meeting is something that you're interested in, and we'll send you a personal invite. Thank you again, Ryan, for being here today.
Thanks for having me.
Yeah, you're welcome.